NEFRI, or North Florida Foundation for Research and Education, is a nonprofit attached to the VA. It is so that we can accept studies that normally we wouldn't as a government facility, such as industry, NIH grants, etc. And then the VA is able to have those studies here and provide it to our patients.
So our mission is to advance healthcare research and technology for veterans, and specifically for us, it's the North Florida, South Georgia Veteran Health System. Through NEFRI-supported research initiatives, veterans gain access to cutting-edge treatments and clinical trials that address their unique healthcare challenges. Our work drives forward understanding of conditions, particularly those affecting veterans like PTSD, chronic pain, and complex illness management.
We work with the VA population and the VA to establish these studies here, and then we're responsible for recruiting and bringing those people in for these studies. We try to have a wide variety of studies just to meet a variety of characteristics across the board. We have studies for older populations, also for cardiology, pulmonology, or gastrointestinal, and we're always trying to add new and different studies.
We do human clinical trials. So our studies, we talk to the patient, explain the study. If they want to go through the study, we consent them, and we do all the research activities that are related to the study.
You'll usually do like height and weight. We'll go questionnaires, maybe an EKG that we can do in our area in private. We also might do a blood draw or some other biological samples.
So the North Florida Foundation for Research and Education is actually outstanding. So I could contact the staff anytime with any questions or concerns. I'm generally very athletic. I'm a firefighter paramedic. I run lots of races. However, when I became diabetic, my blood pressure started to go up. I wanted really to have an idea of what might be the problem and the best way to regulate it. So my doctor thought that being in this study would be a good idea.
So our research contributes to evidence-based practices that enhance the healthcare delivery system nationwide, and it creates a ripple effect of improved healthcare for everyone, and specifically veterans here.
The great thing about being involved in research is that your days are never the same. So there's always a little bit of work with talking to sponsors, answering emails, but also you get to have patient visits and interact with the patient and do lab work and all those sorts of things. But you can have one day that's very heavy with patients, one day that's paper and computer work.
We have probably 40 to 50 active trials under the foundation at any given time, including other VA-approved research. It's probably closer to 80 to 100 at all times.
Our goal is to bring these new studies or trial medications or procedures to veterans to see if they can help with some of the issues they face. Every study has its specific list of inclusion criteria. That's why when people call, we'll usually ask some general questions like, how old are you? What's current medication you're on? What diseases you currently have or different symptoms? And then we have our database of studies that we'll run through just to see if anything has a fit.
I think that it is exceptionally important for research to improve and save lives. Without research, we can't get vaccinations, we can't get medications, we can't find out problems. It is even more important for military people who have a different aspect than the general population because of the exposures that we experience.
They're usually sick. They're looking for something to hopefully make them better or advance the things that can make other people feel better in the future. And it's just good to interact with them, help them with the study, see how they do with it, and just have that relationship with them throughout the study and after.
I love our staff at NEFRI. It's a great team. There are people that deal specifically with IRBs and protocols and procedures and budgets and finances. Other staff work specifically with patients and carrying out those different protocols we talk through.
We have a website, and if you visit our website, you'll see more information about our clinical trial center, the different type of funding sources that we apply to, how you can help, so volunteering time, donations. We have a lot of areas people can get involved with, either being a subject on the research if it's appropriate for them, or just volunteering time and working with the clinical trial center staff or with us administratively, based on the skills a person has and what they're looking to get out of it.
As a nonprofit, we do run also on donations from the community. So anyone who is interested in perhaps donating to the foundation, they would contact our executive director, Angie Smith. I just hope we can continue to bring in grants and studies that help bring medications and treatments to our VA population.
We need to provide funding to continue research because without it, we can't take care of the diseases and issues that arise.
By supporting North Florida Foundation for Research and Education, you're investing in better healthcare solutions for those who served our nation and contributing to advancements that benefit all Americans.
Every person has a responsibility, I believe, to try to change the world or try to change the footprints of the earth. And we all can make a difference if everybody chooses to step up.